Hey guys, Phil here, Doctor of Physical Therapy. Today we will be talking about rehabbing the shoulder for barbell athletes. First of all, who is this for? Say you tweaked your shoulder at the gym and you are looking for answers. This guide is for you. When you Google what is wrong with your shoulder, chances are it leads you down some mechanical description of what's structurally wrong with your shoulder. That can lead you down to a rabbit hole of more medical utilization in the form of doctor's visits, medical imaging, which means x-rays or MRIs, pain medication, injections, or other adjunct treatments such as acupuncture, joint manipulation, massage, whatever the case may be. You see, the secret is that the body is adaptable and it has an amazing capacity to heal, despite having an imperfect image on the inside. The reality is the majority of shoulder injuries in the gym are non-threatening and not serious and do get better with rehab. You might be wondering, what if I have a rotator cuff tear? What do I do? Well, studies have shown that the prevalence of rotator cuff tears in the asymptomatic population, so people without pain in their shoulders, is as high as up to 22%. And that number just increases further with age. How I like to describe it is, say you do have a rotator cuff tear, the body actually has a lot of backup systems. There are fibers that are intact. By strengthening the fibers that are intact, we can increase your function, increase your strength, and decrease your pain. Say you're not convinced and you think you might need surgery. Admittedly, depending on the severity of rotator cuff tear and your history of injuries, some shoulder injuries do require further medical interventions such as injections or surgeries, especially if you have some what's called red flag symptoms. These symptoms are more serious and may require more urgent medical care. But most tweaks in the gym do not warrant jumping straight to surgery. Chances are, if you do consult with a surgeon, they will recommend physical therapy before considering surgery. So regardless, you want to give rehab a shot, aka conservative care, before doing something more serious. So without further ado, these are some of the red flag symptoms that we want to clear before we jump into the rehab portion. These include significant loss of strength and dexterity, significant numbness and tingling in your arms, recurring dislocations, and pain at rest or pain at night. With that out of the way, let's see how we can get you out of pain and get you back into the gym. Step 1, calm things down. Chances are when you tweak your shoulder in the gym, say doing a bench press, there might be some localized inflammation in the area. So we do want to avoid movements that significantly increases your symptoms. So that might be taking a day or two off, maybe performing accessory work or decreasing the load of your bench press. You can still continue to train, but you just want to avoid anything that triggers a medium to high level of pain in your shoulder. Sometimes that's just not worth it. So in order to create a healthy environment for your shoulder to heal, we can modify your training temporarily. So that can mean decreasing the number of reps, decreasing the physical load that you're lifting. That can mean substituting to a different movement, but you can still train the same area. Or it can mean reducing the range of motion of the movement. So let's go over it one by one. So reducing the number of reps. Say we're working on bench pressing, instead of doing 10 reps, maybe only doing 6 or 5. Reducing the number of weight. This is pretty straightforward, just decreasing the weight that you're pushing. Instead of working at a challenging weight, maybe dropping that off and performing more reps at a lower weight. Reducing the range of motion. Say with a bench press, at the bottom of the press, that's where you get that shoulder pain. So limiting yourself to a partial range bench press so you're not coming all the way down. So you can do something like a press from the floor, or you can even substitute the exercise entirely. Say barbell bench press aggravates your shoulder for some reason. You can temporarily change to using dumbbells, and that can be more comfortable on your shoulder. If you play around with some of these variables, sometimes that's all it takes, seriously. Step 2, to build things back up. So after your initial injury, shoulder is a little achy, there's an inflammation going on in the joint, you let it heal, you modify your activities temporarily, decreasing the load or decreasing the range of motion. Things have calmed down now. Now you can start introducing some accessory work for the shoulder. So there's this concept called treat the tissue with the issue. So remember we talked about modifying the movement, modifying the range of motion, or modifying the weight. So by all means, continue to bench press, but change it up slightly so your body can tolerate it better. That's how you can continue to build strength, build capacity, and let your shoulder heal. In terms of accessory work, sometimes all you need is an exercise band like this. So you can get these easily on Amazon. So out of the set of bands that comes with it, this one is the lightest one. So the idea is we want to add in some accessory work to train that rotator cuff. So keeping your elbows by your sides, palms up, you want to pull the band out. Just like that. So you should feel some muscle activation in the back of your shoulders. You can do these as a warm-up before your shoulder workouts, 3 sets of 10, 15. Next, we got some band pull-aparts, so you can go pull out diagonally. The idea is we want to engage all our shoulder muscles and get them warm before you do your main movement, which is going to be the bench press. So 3 different directions is 1, you can do 4 or 5 in each direction. You can do 2 to 3 rounds of those before you begin your workout. And last but not least, you're going to keep your elbows by your sides again, palms up, a little tension in the band. And what you're going to do is you're going to raise your arms up. And the trick here is not to let your elbows flare out like so. You want to keep your elbows parallel and go all the way up, push, and all the way down, just like that. You can do 5 to 10 of these, 3 rounds or so. This exercise will engage all your rotator cuff muscles before you start your main strength movements. So all in all, in conclusion, the idea is most tweaks in the gym are non-serious, and you can continue to do your movements, but temporarily modify some things. So give these exercises a shot and let me know how things feel. And remember, this is for educational purposes only. If you do have a nagging shoulder injury, I highly recommend seeking out a physical therapist who understands lifting. That's it for this video. Thanks for watching. If you like this type of content, let me know. Consider subscribing if you want. And there's more to come.